Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're diving deep into a condition that affects millions of people every single day. It's called GERD, or Gastroesophageal Reflux Disease. If you've ever felt that burning sensation after a meal, or dealt with sour burps, nagging coughs, or just plain discomfort in your chest, you're not alone. But what if your symptoms keep coming back? And more importantly, what can you do about it? To help us today with this topic, I'm joined by a distinguished guest in the field of regenerative and integrative medicine, Dr. Bryn Henderson. Dr. Henderson is a pioneer in advanced medical therapies, blending conventional care with innovative treatments like peptide therapy, gut healing protocols, and more. With decades of experience in treating complex conditions, Dr. Henderson has helped patients who have felt stuck, frustrated, and overlooked. Today, he joins us to share new hope, new solutions for GERD, especially for those of you who are living with the chronic symptoms of GERD. Dr. Henderson, it's a pleasure to have you with us today on Doctor.
Thank you.
Okay, so let's start with the basics. What exactly is GERD?
GERD, or gastroesophageal reflux disease, is when acid from the stomach keeps flowing back up into the esophagus, and that's the tube that carries the food from your mouth to your stomach. This backflow can irritate the lining of your esophagus, causing that burning sensation that we know as heartburn. Over time, it can lead to other issues like coughing, trouble swallowing, and in some cases, more serious damage if not treated properly.
So let me ask you this. Where does this GERD happen?
A GERD occurs in a weakened lower esophageal sphincter, the muscle that tightens the esophagus with the stomach.
So it's at the bottom of the esophagus.
That's right.
Okay.
And when it gets weak, it allows stomach acid to backflow into the esophagus.
Well, my next question is about how does it get weak? How do some people avoid it and have strong bottom of their esophagus? Why does that happen to some people and not others?
Well, it can be many factors. That's what we're going to go into today. The big reason is the weakness of the lower esophageal sphincter. That valve that should stay shut after we eat sometimes doesn't close tightly. If that muscle relaxes when it should not, the acid creaks up. And things like obesity, poor diet, smoking, even lying down too soon after a meal can make it worse. But it's not just lifestyle stuff. Some people are born with a higher risk. Genetics and even what happened during their time in the womb can play a role.
All right. You mentioned genetics and development. That's going to be very interesting to people to say, oh my God, was I born this way?
Well, research shows that GERD can actually run in families. Certain genes can affect how your digestive system works, how sensitive your esophagus is, of how it handles inflammation. And during pregnancy, if a baby is exposed to conditions like maternal obesity or smoking, that can affect how well the esophagus and diaphragm form. Babies born early or with low birth weight also tend to have a higher GERD risk later in life.
And so what are the telltale signs of GERD?
The classic one is heartburn, that burning in your chest, but doesn't stop there. Some people get a sour taste in their mouth, regurgitate food or liquid, or have a chronic cough. Others might feel chest pain, get hoarse, or even have dental erosion. It's important to know that GERD symptoms can be subtle too. Some folks don't even get heartburn, but still have reflux. Now, usually we start by discussing this conversation with the classic symptoms. We might do a trial with acid-reducing medications if they feel better, But if there are warning signs like difficulty swallowing or weight loss, we'll go further. We do an endoscopy to look inside the esophagus and test the pH, the acid-base balance, to measure acid levels. That helps us know what we're dealing with and rule out more serious conditions.
Okay, so let's say we put somebody on omeprazole or famotidine or some of these anti-acidic medications. When I was in medical school, I learned you couldn't give them these medications for a long time. Now we're seeing that these people are on it every single day of their life. I have a problem with this. Do you?
Well, not only do I, but so do the people taking it. Our foundation should be lifestyle changes. That's the foundation. And to make it easy for patients to remember, we use the mnemonic. And the mnemonic is what they experience, heartburn.
H
is for head elevation when sleeping. Raise the bed to prevent nighttime acid reflux.
E.
That's eat smaller, frequent meals. Large meals increase stomach pressure.
A.
Avoid trigger foods, spicy, acidic, fried, and fatty.
R.
Remain upright after eating. Wait 2 to 3 hours before lying down.
T.
Is take your medications as prescribed. This includes the antacid, the H2 blockers, or the protein inhibitors.
E.
Break the smoking habit. Quit smoking. Smoking weakens the esophageal sphincter.
U.
Use alcohol in moderation, if at all. Alcohol relaxes the sphincter and worsens reflux.
R.
Reduce weight if needed. Losing excess weight relieves the pressure in the abdomen that pushes up on the esophagus.
N.
Notice and manage stress. We could say it 10 times. Stress exacerbates reflux. Relaxation can help.
All right, so I'm going to just stop right here, and I want to tell you what happens in my practice. In my practice, they'll come in and they say, "Doctor, I'm feeling pain here." And they take their hands and they point to the upper part of the diaphragm. They are not saying anything about the esophagus. They're going like this first. Give us the difference between when the esophageal sphincter is weakened versus your diaphragm has gone spastic.
That's a good question. It's easy to distinguish. The reason it's easy to distinguish is when the GERD and the reflux goes up, it goes up towards your neck.
Yeah.
The initial is across a band, like your tummy.
Yeah.
So it's very easy to distinguish.
So when they're doing that thing where they're pointing to their diaphragm and they're saying it's here.
That's gastric. That's in the stomach.
Okay. So, and then if they point to the esophagus, then they're going to have to go have an endoscopy. Now, you mentioned pH. The doctor, the gastroenterologist, will do an endoscopy. And of course, they've got a camera down there looking at the damage. But they're testing the pH to decide how bad the acid is?
Yes, pH stands for exactly a change in the acid-base balance. So when that acid gets over a threshold, then it gets more negative, right? And it's going to cause more burning.
Okay, so what do gastroenterologists do when we refer a patient to a gastroenterologist for this? Do they have something in their tools that we don't have?
You bet. They use manometer. Manometric pressure determines in the esophagus where the pressure is as it goes down, and then they stick the endoscopy a little deeper and see how the sphincter performs. And then they also look to see if there's any erosion spots on the top part of the stomach.
So now we've done the pH, they've done the thing, and they send it back to us. And here we are writing our prescriptions for famotidine and omeprazole. And what are alternative options now for people who are fed up with their doctors and say, I am done feeling like this. I have to go down a different pathway. What is that new cutting edge pathway for GERD?
We treat GERD today with real breakthrough. We use peptides. Those are the proteins that are bound together like BPC 157 or thymosin beta-4 to help not only stop the acid, but it helps heal the esophagus. And it improves the muscle tone of the lower sphincter. The peptides reduce inflammation, repair that tissue, and support gut health. They also optimize the gut microbiome. And the microbiome's all the little bugs in there that need to be balanced. So we tailor the probiotics and anti-inflammatory diets so that it enhances our care and gives us a better balance, not only pH, but also the muscles and the tone. There also is new research that's shown that if you need new cells, you can use regenerative cells that improve the nerve signals, usually the vagus nerve, and that helps esophageal valve function properly.
Okay, so let's talk about a case that maybe you had that would be interesting to our audience, a GERD case study.
Okay, we had a 49-year-old man who struggled with GERD for 5 years by the time he got in to see us. It started occasionally, heartburn got worse, even taking the oral medicines, the PPIs. He developed Barrett's esophagus, which is very serious, and it's a pre-malignancy. In other words, you can get cancer if it goes on long enough. It changes the esophageal lining, so he felt drained from all the medication. We did a full body workup and found inflammation and poor gut diversity. We began the peptide therapy, customized the anti-inflammatory diet, and improved the gut microbiome. Within 3 months, the symptoms eased. At 6 months, Barrett's had reversed.
Wow.
And 1 year later, he was off all the medications, just an occasional antacid, and he was feeling much better.
This is such an inspiring story of recovery, and I am excited. And I know people who are listening who have GERD now know. They didn't know before they listened to this show, but they now know there is a way to reverse the sphincter weakness, a way to reverse the acid reflux, to reverse the GERD. This is unheard of before. We just gave them palliative medicine, like keep them comfortable. Now we can reverse it. And I hope those of you who are listening will get this hope that we've given you.
Absolutely. Many people feel stuck in the cycle, meds and flare-ups. But when we look deeper at the healing, not just the blocking symptoms, you can give patients relief. And of course, it's not a one-size-fits-all. But for those with chronic or stubborn GERD, there's real scientific-backed options beyond conventional care.
That makes me happy. Before we close, how does traditional Chinese medicine fit into GERD treatment?
Well, that's interesting. It could be a great complement. Acupuncture, which has been around thousands of years, has shown promise in improving the function of that lower sphincter, and it reduces the symptoms. And certain herbs can soothe the digestive system. It's a gentle approach that can support the body's natural healing processes, especially when combined with our other therapies.
Well, we've given everybody a lot of information, and I hope you learn that there are new treatments. You do not have to be stuck in a cycle of just swallowing a pill every day and hoping for the best. I hope you know that you do have to have lifestyle changes. And you have to be proactive about this and not be so complacent with your health. As you've heard today, even the toughest cases can be turned around with the right approach. And like Dr. Henderson said, it's not a one-size-fits-all, but there are things that you've probably never heard of that we're doing today that will help you. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.